Starting tomorrow, you can order free at-home rapid COVID-19 tests through a government website. Now, some of you have some questions about the test and when to take them. To help answer some of them, we're bringing in 9 Health expert Dr. Pyle Coley. Good morning, Dr. Coley.
Hi there, good morning.
So my first question, a lot of people asking, when and how should we use these rapid tests?
This is great, Natasha. We're going to have access to at-home rapid tests, but we have to use them correctly in order for them to help us. So the tests look for viral particles. So they actually perform best when there's lots of virus around. So if you think about that, that means that you probably should have had symptoms for at least 1 day in order for you to use this test. So you don't want to use it the minute that you have symptoms because you may not have enough virus around, especially if you're vaccinated, because vaccinated people start to have symptoms early, even when the viral load is very, very low. So usually I like to use them a day after I've had symptoms to check and see if they might be positive.
What test should we use if we've had an exposure or we're going to go see someone who is high risk but they have no symptoms?
Great question. So this is not the place to use these rapid tests. And I want to reiterate that because a lot of people are saying, oh, I'm going to go see grandma. Let me just do a rapid test and see if I'm positive. Because if your pre-test probability, meaning you have no symptoms, so the likelihood that you're infected is low, the performance of the test goes down. It's more likely to give you the wrong answer rather than the correct answer. So the right test to use to go see grandma is the PCR test, the day that you're planning to see her, whatever, a couple of days before. If you've had an exposure, you don't want to go get tested the same day with the PCR test. You actually want to wait 2 to 3 days and then go and get that PCR test. But do not use these rapid tests for those purposes.
Let's talk about these rapid tests. Do they pick up the Omicron variant as opposed to prior variants?
So the test was designed to actually look at the original Wuhan variant. Those are the viral particles it's best at picking up. The FDA asked this question very recently about the Omicron variant, and they found that, of course, the PCR tests, which amplify the virus's genetic material, those perform the best for Omicron. These ones do have a decreased performance, so they're not doing as well for Omicron as they did for Delta or Alpha or some of the original variants, but they are still probably adequate in terms of picking up when you have a high degree of viral load.
And Dr. Coley, you kind of touched on this earlier about getting a false negative test. You know, what are one of the top reasons for one of those false negative tests, and how do you avoid doing that?
So the biggest reason really is sample collection, because remember, we're doing these tests on ourselves, we're doing that at home, so you have to really be sure that you get a good sample. So I want to show you how to collect the sample. So pretend that this is the Q-tip that comes in the testing kit. Okay, so you want to make sure that the entire length of the Q-tip is inside your nose by at least a ½ an inch, and then you want to do 15 big swirls in each nostril, doesn't matter what direction, just to make sure you get enough of a test sample. And I'll show you that in a second. There's also some data that we should actually be transitioning and doing saliva collection for Omicron because that may be performing better. So you're ready here to watch me do my rapid collection. I'm putting it in and it's all the way in and it feels uncomfortable. It makes me feel like I'm gonna wanna sneeze, but I'm doing nice, big, slow circles, and you wanna count a full 15 seconds. And then when you take it out, be sure not to touch it to your face, to the table, anywhere else, or contaminate it. Put it directly after you do the other side. Put it directly into the analyzer set and swirl it around to break up those viral particles and release them.
Yeah, you know, I think it's so important that you collect a good sample in order to get that accurate result, like you just said, Dr. Coley. Appreciate you demonstrating that, and thanks so much for answering a lot of those questions. And at home, if you'd like to order a free test tomorrow, you can visit covidtest.gov, covidtest with an s.gov. The White House says that you're limited to 4 rapid tests per address.